Hello, you're listening to Ending Physician Overwhelm, and I'm your host, Dr. Megan Mello. I'm a physician and a life coach for physicians and other professionals. In this podcast, we look at why, as physicians, we often get stuck in feelings of overwhelm, anxiety, and burnout, and how we can break out of toxic thought patterns. My hope is that each episode gives you an opportunity to heal and get more clear on how you want to show up in your life and your work. And now, let's get started. Well, hello and welcome. Today, I have a special guest with me, Dr. Leslie Golden. She is a fellow family and obesity medicine physician in Watertown, Wisconsin. Dr. Golden received her MD at Ross University and also holds a master's in public health from Florida International University. She is currently building a coaching and education platform for people wanting to work on achieving and maintaining their goal weight for their long-term health. And she enjoys biking and is her town's local resource for helping wildlife in need. Dr. Golden, welcome.
Hi, thank you for having me. I'm happy to be here.
Yeah. Well, I was hoping that you would start us off here. You had an experience early in your career that had a pretty profound effect on your perspective of the practice of medicine. Will you share that story with us?
Yeah, sure. Within the first year of getting out of residency and coming and establishing my practice, I had this great idea. I'd come up where my parents lived and establish this small local community practice. And there was a organization at the time that was affiliated with a big academic center to where I could still engage with residents and medical students, but also have this small town feel. And it was an employed position. And at the time I was like, great, I only will have to worry about medicine and someone else can handle everything else. Cause I don't want to have that blurring the picture for me.
Billing and hiring and all that.
Yeah.
No thanks.
And, living right down the road from my parents' office, right down the road. And not far into it, unfortunately, my mom was diagnosed with glioblastoma, so a type of brain cancer. And she rapidly declined. And my life essentially became trying my best to balance establishing this new practice within an employed model, and balancing her needing 24-hour care along with my father helping. And so it really changed everything for me in multiple ways. So trying to figure out that balance that we all search for in a really significant time where it's hard to find balance already. Mm-hmm. And also trying to manage the difficulty of the healthcare system from the patient situation that I had never been in before. Yeah. And, watching and trying to advocate for my family through appointments and seeing how we were treated, even in the best of circumstances, as a number, and not really anybody's definite priority, although we were still getting the standard of care. Mm-hmm. I never want to imply that we didn't get the care that we needed, but it was just eye-opening of what our medical system is like from the other side. Yeah. And it really, really had an impact on me of realizing, what is my role in that? Like, what experience do I create for other people? And if I'm blaming that experience on, well, the admin makes me keep short appointments and the admin requires me to bill this or that, or, you know, is it really my role to try to change that, or am I just allowing this to happen? And I was already a little disenchanted by
Mhm.
the employed model. Having administrators call and ask me why I am or am not treating a patient a certain way, because maybe the patient would just want a specific treatment plan, even though it wasn't
Mm.
medically necessary. But you know, having to have a certain flow, a certain way of documenting, you know, forcing breast cancer screening discussions on a patient that's actively vomiting because the quality measures say you have
Right,
to
because
ask
it's
them every
due.
time. You
Yeah.
know, and it just really got me in a situation where I was just very unhappy. You know, I this idea of being this great local family doc that had this wonderful relationship with patients. And I wanted to do family medicine because of that value of that patient physician relationship, right? I mean, the stronger that is, the more the patient can share with me, the more that I can help them. And
Mhm.
only then can we really make a significant impact. And that's hard to do in 15 minutes.
Yeah.
And it's definitely hard to do when you don't feel like you have that support from your staff and from the administration, and the goals just aren't in a line.
Yeah. And so often, the administrators or, even the staff, they're not in the room sort of watching the conversations with patients unfold and really understanding why you can't cover all 5 questions from the patients and the breast cancer screening and establishing rapport and
Mhm.
getting the note done in a tidy little 15-minute
Mhm.
package with a PAP.
Exactly.
Yeah.
Exactly.
Yeah.
And then there's that too, you know, document the whole time you're in the patients
Mhm.
understand. And, you know, I've definitely developed early on and still use this. There are certain conversations or lines that a patient uses, you know, usually, you know, stressful situations,
Mhm.
depression, things like that, where I just close my laptop
Yeah.
and fully focus on them. And, you know, it's easy for someone sitting outside the exam room to say you should be documenting the whole time. By the time the patient leaves the room, everything should be in there. But when you're not the one having to look them in the eye and support them through possibly one of the most challenging times of their life.
Yeah. Yeah.
Yeah.
And then you ended up leaving that practice, and like so many people, deciding on private practice and thinking, great, I'm leaving behind, this place where it feels like, I can't really thrive, and I'm going to go and be in private practice, and that's going to help. Tell us what happened with that.
Yeah. So, you know, being disenchanted with that situation and seeing there's a local practice where I'm still at now, where there are a group of providers, and you know, they seemed happy, they seemed to love practice, and was lucky to be welcomed into their practice to start um, for a year as kind of a semi-employed, and then transition over into an owner. And I thought initially that it would just be an immediate change, you know, that it would be how I wanted it to be. I would be happy, rainbows, butterflies, everything, you know, everything I ever wanted, because now I get to decide
Mhm.
the rules. Um, and I think it, it seemed that way for a little while. Um, and then it's just new frustrations that start,
Mhm.
right? Prior authorizations, reimbursement demands, you know, overbooked schedules, and even though you're the person making the decision, when you don't have enough time in your schedule to see all the patients that want to see you, you still have to start making some tough decisions.
Yeah.
And just the charting and all the follow-ups and the messages and getting, not having alignment with the way you want to practice, and the amount of time there is, and really, once again, just completely burnout, not sure if medicine is what I thought it was, not sure that there really is a good fit. And I mean, even going to the extremes of, I started learning about wine because I was like, oh, I'm gonna open a wine store and just do wine tasting and sell wine, because gosh, that's going to be a lot easier than this, and because I don't know how this is going to work anymore. And it's sad because we joke about it, but there are so many physicians across the country that are experiencing these things, and are just leaving medicine completely, for jobs with less stress, with less administrative burden, and we've put so much work into trying to find the best situation and be kind of a gift to others in the community, and it's sad to see so many of us kind of transition out of that and just give up on it.
Yeah Barista has always been my fallback job. But I'm thinking about it, you need to be the wine shop owner for the physician-owned wineries that are out there in the country.
There you go.
We'll make it really full circle. Oh, I'm curious to see what you would say about the role that boundaries did or didn't play in your experience within both the private practice as well as the hospital-owned clinic, because I really believe that, unfortunately, many of us were really brought up to not have boundaries, and that was only exacerbated during training of like, nope. You will work as much as we say, you will do the things that we tell you to do. And sort of how that played out for you in your experiences in these two clinics.
Sure. And that's what a great point, because boundaries in learning boundaries was how I eventually kind of got out of this mindset. But looking back, gosh, I don't know if I had any at all. I mean, even before med school, I was always this kind of overachiever, people pleaser. If you asked me to be on any committee, any club, any role, yes. I mean, I think
there are times for this thing.
Sure. There were times that I think I was working 2 or 3 part-time jobs in high school because there's always more opportunity, and so definitely as in the original position as an employed physician, just coming in, and I remember I was coming in, there were supposed to be 2 other physicians along with me in the practice and 4 APPs. So I think it was 2 nurse practitioners, 2 PAs. Within a couple months of me starting there, it became, I was the only physician. And they were going to maintain the APP model, not necessarily hire more physicians. And could I handle that and supervise and collaborate? And looking back, it's like, of course not. I'm like just out of training.
And meanwhile, they keep slipping in more and more.
I need my own,
not changing your schedule.
Yes.
You just magically supervise all these folks.
Yeah. It's like, I need my own mentors too. I'm still growing and learning here, but
you're so early in your career.
Sure. But of course, at the time I was like, oh, I can handle this, because I can supervise them. And in just that same situation, no adjustment in my schedule, still seeing the full load. being available to supervise multiple providers, be the backup to handle all the calls for all those providers. And then additionally, there was this, would you like to be on the board for the hospital? Would you like to be on the medical staff? Would you like to be an officer on the medical staff? Would you like to be, like, within a year, it was like, would you like to be the chair of the primary care department for the hospital? And of course, they all just seem like honors awards. Yes, of course I'll do that. So creating my own terrible situation, because not even checking into, like, do I want to do this? Does it matter to me? Is there real value? Is it in alignment with my goals for what I really want to accomplish? So definitely no boundaries there at all, right? And even transitioning to private practice, I still in some ways carried some of that with me, because it was the same hospital system. We are private, but kind of we're credentialed at the hospital. We have we can see patients there if we choose, so we're still on medical staff there. So my medical staff role stayed as an officer. I was still on the board for the hospital for some time, and then taking on being an officer within the private practice, and just continuing, and then adding on, because I felt I was in private practice, completely owning the relationships with the patients and not having good boundaries there either for when I leave work and work stays at work, and not necessarily following up on things on in the evening, just trying to be, the best that I could possibly be.
Because we feel so much of that compassion to be all things to all people, right? Not recognizing that we are a finite resource.
Sure.
Because we actually are.
And it became difficult too, because I think in the employed model, at least I could somewhat blame a lot of the rules and things on the admin. Now, as an owner, it was almost a difficulty I didn't expect, that I wasn't protected by these policies, that if I chose not to engage or put in a certain amount of work, it was completely me choosing to do that. And was that okay to have any type of limit on my work schedule at all?
We're so capable of overworking, I think. And, I think it's such an important mindset piece to be aware of, because it's so easy to carry that with us wherever we go, right? If we go to another job and we like magically, like, the job will make this better, but we're still like, I do all the things for all the people. Yeah, it's just too much. It's just too much. Yeah. Oh, thank you so much for sharing that story. And tell us a little bit about your transition into more obesity medicine.
Yeah. So it really started in some ways by accident. I mean, it wasn't fully intentional. I had no idea that it would end up being this way. And it's one of those things where I look back throughout life and I was probably always meant to do this. And these slow habits building up over time, these experiences that kind of all brought me here. But I'd say about 3 or 4 years ago, I was working with one of my many patients that struggle with diabetes, and found myself just increasing insulin and increasing insulin and increasing insulin. And, had in some ways kind of stopped trying to get some of the newer agents approved, because you just kept hitting walls. And all the colleagues around me too were like, you never get that stuff approved, so what's the point? And one day I just kind of said to her, do you want to try a different approach? Um, why don't we try to see if we can address the weight that keeps going up with the insulin rather than increasing the insulin? And at the time, we used anti-obesity medications at first that weren't related directly to
Mm-hmm.
diabetes
Mm-hmm.
treatment, and it started working.
Mm.
And not only did it eventually lead to her no longer being on insulin, but quickly, over even the first few months, as a little bit of weight came off, seeing the confidence in her change,
Yeah.
her self-worth change, her belief in herself that she can actually take care of her health again.
Mm-hmm.
I gave her hope, hope that she had never had,
Yeah.
or hadn't had in a long time. And that was transformative for me in multiple ways. And once you start to get that feeling, it's really hard to let go of, because I
Yeah.
think that's part of the burnout too in medicine. Of We just see like pain that never goes away, and unhappiness that never goes away, and disease that doesn't go
Chronic disease
away. And
getting worse and
it's
worse.
it's so hard to really go home at night and believe that I made a difference.
Yeah.
And helping people with their weight, there's so many, especially as a family medicine doctor, you can relate. How many conditions do we treat where they're just the result of a weight issue that,
Right.
as physicians, we've kind of ignored because we didn't really know what to do.
Yeah.
Nobody
I mean,
really
the
taught us how to
conventional
address it.
calories in,
Mm-hmm.
calories out,
Mm-hmm.
in my experience, mostly taught to me by naturally thin older white men,
Very true.
who have
Exactly.
not struggled with their weight. And, the science really wasn't there, and it really wasn't taught. And
Mm-hmm.
yeah, I think you're right.
Yeah.
For me, it was the similar thing of like, we're struggling so much to take care of kind of these worsening sort of end state chronic diseases.
Mm-hmm.
Why aren't we going more upstream and being like,
Exactly.
yeah, how do we stop this?
Mm-hmm.
How do we help people early on to get the weight off and fix, the eating, and reduce the blood sugar resistance, and all those things that really
Mm-hmm.
sort of feed into the whole picture. So yeah, that
Yeah, definitely. Yeah,
resonates for sure. I think we've got an
sure.
explosion of, obesity medicine certifications and lifestyle medicine certifications and all number of
Mm-hmm.
other sort of additional certifications out there that, primary care doctors are really seeking, because we want to stem the tide, right? We want to
Mm-hmm.
be able to do more.
Mm-hmm. And for me too, I think it just restores that connection, that
Yeah.
that whole person comprehensive approach that so
Mm-hmm.
many of us were always seeking, that we
Mm-hmm.
didn't get. Because when you treat weight, you treat behaviors and coping skills, and
And
you
mental
treat
health. Yeah.
immobility and mental health and self-worth. And you're treating the whole person in ways you always wanted to, in an environment that's completely supported for you to do it in that way.
Yeah.
So it's refreshing, and it's refreshing for patients. It's one of my favorite things to sit down with a new patient and have the "it's not your fault,"
Yeah.
the shame and blame can stop
Yeah.
conversation. And you know the 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 mental weight that is
Yeah.
released for them is incredible, and being able to offer that to people has been amazing. Because I know for me, part of it, as I learned more, so this patient kind of inspired me to figure out more and learn more. And it's almost like Pandora's box when you start to learn the new science of obesity. I thought, I'm a family doc. I can read a little bit of obesity. I do this all the time anyway. What more could there really be? And then you get into like the pathology, and where there's the picture of the brain with all the different signaling hormones. And I had a moment there of, do I really want to do this? there's a lot more to this than I realized.
There's a lot here.
But of course dove right in, and it helped me as well too, because gosh, it made so much sense, and it's kind of changed my life and my health as well too, because I genetically come from a family that's always struggled with weight despite being active, and my whole life always was trying to figure that out. I had a father that was in the Army Special Forces for his whole career, very active, running all the time, and always under pressure because of his weight being at the cutoff. And in my whole life, hearing the whole calories in, calories out, just in watching him, in to me as a child growing up, and even later as a doctor, this just doesn't make sense. And watching so many other successful people, I mean, as doctors and CEOs, with the amount of discipline that we have, the amount of work ethic, and we still struggle, and this whole idea of, oh, just get some more self-control and you'll be able to handle it. It just didn't make sense. And so I was glad to be able to learn more about this, and realize that the natural teacher in me with patients, wanting that whole patient experience, with helping them with their whole life, and just my personal struggles. I was just kind of throughout life just created to be a weight doctor without ever knowing it.
No, I that so resonates, just like all your experiences coming, into this to show you like, this is your sweet spot, this is your zone of genius, as they say. That's amazing. So I always ask people to say, what they would want someone who's currently feeling burned out, currently feeling overwhelmed in their medical career. What would you want them to know? What would have been helpful for you to hear when things were rough?
Yeah, I think just keeping an open mind, and being willing to go internally, to evaluate. I remember so many workshops along the way, that were focused on physician wellness. And they would talk about, perspective and self-care and mindset, and looking at things as a choice rather than a have to. And I always remember having this attitude of like, whatever. Admin told them to come and say this.
You don't know what my life is like.
This is not about me. This is not about me. This is about the charting. It's about the EHR. It's about, if you fix all that, it's all external. And I really wish I would have paid more attention, or at least been willing to accept and consider it.
Yeah.
Because, through this time with setting up the boundaries, learning more about mindset, learning more about positive psychology, in seeking coaching and help myself, that is what got me out of it.
Yeah.
For me. And it's not because people didn't try earlier. They did. I just wasn't willing to hear it.
Yeah. Because you have to have some openness. There has to be, a little crack to get the door open. I think that's really helpful. And I think you're right. Like sometimes we maybe we can't hear it from the employer sponsored person coming in, But,
Right.
finding a way to connect with some of that, finding a way to reconnect with your feelings and, kind of what you want for yourself and how you want to show up and be, I think is really crucial for people. So thank you
Yeah,
for sharing that.
of course.
Well, tell my listeners where they can find you.
Oh, sure. So my platform that I'm building, Weight and Gold Wellness, currently on Facebook and Instagram, building a website for it, and watertownfamilypractice.com. Anybody in the state of Wisconsin, I'm able to provide obesity medicine care for.
Awesome. Great. We'll have links to that in all the show notes. So
Great.
Leslie, thank you so much for joining me. It's been a real pleasure to talk with you today.
Thank you.
Thank you for listening to Ending Physician Overwhelm. If you've learned something today or felt moved, please share this episode with a colleague and be sure to like and subscribe so that you don't miss an episode yourself. If you'd like to know more about me and my coaching practice, you can find more information at www.healthierforgood.com. Until next time, take care.